Mic check, mic check. All right, let's see if we can get the music out of the background. Hey, this is Dr. Brown. Was calling to see if we still wanted to do the show for today.
Was there a program today?
The health facts.
Excuse me?
Health facts.
Hold on, let me get someone that knows more about it. Hold on.
Okay, no problem. Give us about 2 or 3 minutes, folks, and we'll be on. Just had a little technical, I guess, a little coordinating issue with the radio station.
It's time now for Health Facts. For you with Dr. Brown.
All right. Thank you very much for that introduction there. Good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All right. So yeah, we had to do a little switch around this week. So I had to move it from Wednesday to Friday. So happy Friday to everyone. Hopefully you're leaning into a really good weekend. And of course, I think everybody's getting a little thawed out from the weather. The snow's all melted and the sun is out, right? So today, what we're going to be doing is something yet again. I love doing things a little bit differently in terms of how we approach health. Of course, sometimes we, health facts, we'll do these, kind of, normal health talks, medical talks, I guess, where we talk about, a certain topic, whether it's, a colon cancer or hypertension. And then sometimes we talk more in general about lifestyle medicine and how that can arrange. Of course, we just finished talking about, kind of men's health and how men approach health and wellness. And and we like to take kind of different angles on our health, on how we approach our health journey, our medical journey. Now, of course, I always like to tell people, we always have to do a disclaimer that I'm a doctor, but not necessarily you're a doctor unless you sign up for the clinic. So of course, if you have any specific health issues, you always have to talk to your doctor, your physician, and address your specific health issues. But of course, we're here for education about education and some entertainment, hopefully, about your healthcare journey. And today's topic, we're actually going to, for the next two shows, this show and the next show, we're going to try to tiptoe into a topic that that is a little bit difficult. I think it's things that we see a lot. We see a lot. I think as a physician, I see it a lot in the clinic. And as I talk to friends and family, of course, you see this issue that we're going to talk about today and for the next show. And it is kind of the intersection or the relationship between health or medicine and religion. And of course, from a religious standpoint, I'm Christian, so of course I'm mostly familiar with that religion. There are a lot of other faiths that are out there as well, but like I said, that's the one I look at the most. And the nidus or the cause of this is from situations where we see or where I and some of my colleagues will see where an individual will kind of use their religion as a way to not pursue, medical therapies. So like I said, maybe somebody that has, yet again, I'm a blood pressure guy. So of course, most of mine are blood pressure, someone that has high blood pressure who doesn't want, typical medicine because they say that, God will provide or God will cure me. And, implied within this statement is implied within the statement is this thought process that religion and medicine are kind of opposed to each other, or that there's a difference between the two topics, right? And so so we're going to I don't know about tackling, but we're going to address this. And part of this comes from my experience as a physician in terms of being the doctor that provides the medical advice or the medical therapies, and having it push having individuals push back on what might be prescribed either by myself or maybe one of my colleagues, right? So sometimes you get that pushback there, and having to negotiate, making sure that they understand the implications of what they're doing. And the other part, of course, as a Christian, you go to church, you hear different sermons, and then, of course, as you read through the Bible and get information from various religious experts, understanding that really, healing is part of that Christian faith, and like there's a lot of overlap that's there, right? And so that it's not really a science or medicine versus religion, but a lot of times there's a significant overlap, and it's more about kind of sometimes I think from a healthcare perspective, maybe explaining how these things work, and also from the patient perspective, understanding that being prescribed a pill is not is not negating your faith, that these things often work in concert, and that it's not a failure of your faith whenever you get prescribed medicine or procedures and things of this nature. So that's kind of the framework for this, for these next two sessions. And then also the other thing is this, and that is, if you really look at read the Bible, kind of look at the Bible, read the Bible, and have it explained, you'll realize that a lot of the wisdom that's within this faith actually works towards your health. It helps to make you healthy. There's a lot of religious training. There's a lot of religious discipline that actually will go towards keeping you in a healthy state. One of the things that we tackle now in medicine is a lot of chronic diseases. And these chronic diseases, a lot of times, are driven by, things like obesity or inactivity. And if we really kind of read that Bible, like I said, as I read, I read through it, I'm like, wait a minute, it tells you about, it emphasizes work, it emphasizes things like fasting and a lot of the things that we actually are now, from a medical standpoint, actually starting to almost prescribe as part of that journey. So so we want to make sure that we can that we address this and make sure that we make sure that that we start to see this as a complement, that's medicine and religion are really complementary, that they're not really in opposition of one another. Okay, so so and we'll start by looking at a little bit in the past. And like I said, this is very, because it's very I'm not a historian either, so this is not this is kind of a just kind of quickly looking at the nature of Christianity and the nature of medicine and how these things overlap, right? So it's the stethoscope in Scripture, that they're not in opposition. They kind of share the same bedside, and kind of starting out with, even if you look at the Old Testament, remember Leviticus had laws that address things like like leprosy, or like I said, if there were certain issues that were going on inside the house, which is very public healthish, right? So how to keep a person that has a contagion away from the rest of the population and keep it from spreading within that population, right? So that's Leviticus. That's all the laws of the. If you ever read Leviticus, my gosh, Jesus, they got a lot of laws in there. But remember, this is well over 2,000 years ago that these laws are being written. They wouldn't have known about, they wouldn't have known about bacteria and viruses and how things spread. But nonetheless, there's a lot of wisdom that went into this, that goes into, where someone had to recognize patterns and recognize, say, hey, hey, if that person has that type of a spot, that person needs to be taken out of the population to keep them from spreading it to the rest of people. And so this kind of underlies how how this religious training would have been promoting science, really at that point in time, right? So if we kind of go through kind of a quick, very succinct kind of historical timeline, the early church, was kind of developed in an era where the sick were often marginalized, right? So back in the day, way back in the day, if you were sick, people just kind of push it to the side. Remember those stories where there's a guy that's wounded, that's just kind of sitting outside the gates, right? So that's what people used to do. They just kind of they were sick, you kind of marginalized, and the early church kind of viewed taking care of the body as kind of a mandate, right? So when there were plagues and stuff of this nature, really some of the Christians stayed around to start nurse some of the sick, when everybody else would be like, nah, I'm leaving out of here, right? And that was supposed to be part of their faith, right? There's this Council of Nicaea that instructed that a hospice be established in every cathedral city. So there's a thing called Saint Basil the Great, and they have essentially started the first modern hospital, and it had apparently specialized wards for different diseases and housing for some of the physicians. So these are some of the things that went on even way back. That's 325 AD. So this is part of this the Christian faith. So the idea that you don't go to hospitals and doctors because of Christianity is kind of, something that doesn't align with history, right? So the church in the past used to have individuals that actually nursed the sick at that point in time, right? So and then you also have things like the scientific revolution, where a lot of the pioneers of modern medicine were actually driven by their faith. You had a lot of the a lot of the especially a lot of Catholics and stuff of nature. I mean, they would kind of do a lot of the scribing there. Then there was like stuff like Louis Pasteur, the father of germ theory, and I think that guy kind of viewed his scientific work as a way to reduce the miseries of mankind, and that was supposed to be to kind of help with Christian charity. So these things are kind of, I don't know if evidence is the right word, or yeah, evidence that being Christian and helping the sick were both kind of aligned, right? So so as we look at this, we want to make sure that we kind of keep those two together. And because a lot of times people, and I remember hearing a young person one time when someone asked them if they wanted to be a physician, they actually said that, hey, I want to be I like medicine, I like science, but I also like my faith, and I don't want to have to choose one versus the other, which was a kind of a disappointing thing for me at least, right? So, but as we look at it, back in the day, like I said, that part of science was to try to understand the world that God put together. And so that's kind of where a lot of these, kind of these older scientists kind of viewed themselves. It's like it wasn't in opposition to their faith, but it was actually a testament to their faith. So they would sit down, they would kind of study these things in order to try to understand how the world worked in accordance to their Christian worldview. And so that's where a lot of this stuff came from, right? So, so as we talk about that, as we kind of cover this, we'll kind of, in our next show, we'll kind of talk about some specific things that that Christians do that kind of promote wellness and promote health. But one of the things that Christianity teaches is that, the body matters, that people are not disposable. And this is one of the reasons why, that this belief helps shape how the Christians viewed the sick. And that's not as a curse. Because you remember before, sometimes people was, if you were severely ill, people would assume that you were cursed by the gods, or you had done something wrong. I mean, even think about Job. I mean, like the story of Job, as Job had bad things happen to him, and as he got sick, one of the things that all of his friends were like, "Hey, look, you must have done something. What did you do? You need to atone. What's going on?" And he just maintained his faith in God. But one of the things that goes on is that, for Christianity, we, even though that person is sick, it doesn't mean that necessarily they had a sin that they're paying for. It just may mean that something is going on, or maybe they're being tested, and that, and that person's being tested, but also that you are being tested because you're called to take care of somebody that can't take care of themselves, right? So so that's kind of how Christians approach health, and part of it is because, and going back to the whole concept of the body matters, right? Our body, we have a spirit and we have a body, and we're called to take care of both. So you can't really separate the two. So the faith part is just kind of the faith part is both is okay. Let me like I said, this is a tough topic, right? So you got faith, you got a faith piece, which is the spirit, and then you also got this body. But your faith kind of affects both of them, right? So your faith really affects both of them. So you can't really separate the two. So if a person comes in, like I said, as a physician, you come in and all right, you got high blood pressure, the science part, the physical science part, I have a, training and teaching and pathophysiology. So I know some of the mechanisms that lead to a person having high blood pressure. And then I also have some, I know how to diagnose it. I put the little cuff on your arm that's been studied by somebody, and we establish the fact that the pressure inside of your vessels are higher than they're supposed to be, right? And there's an outcome that comes out of that, right? And then I also have a choice of, low, eat less salt, little less stress. And I also have this thing called medicine. So I have this thing of medicine. And so what I can do with the medicine is I can actually take that medicine, give it to you, and cause your body to go back into a better shape. Why? And why are we doing that? Because, you know, kind of like, why do you teach people not to sin? Because I want you to live for a little longer period of time. Well, the medicine is the same thing. I want your body to be as in shape as possible for as long as possible. And like I said, I'm not a pastor, I'm not a priest. I can't absolve you of sins. I can't, I can't baptize you. But what I have medications, I have surgeries. That's what we have in order to help this body that you have, this temporary dwelling. Well, I guess in Christianity it's not even temporary. So to make it as long as possible. And so the same way a pastor or priest is taking care of the spirit side, like I said, the medicine side is the physical side is what is kind of my world, right? It's just kind of my world. You get special training in how to approach this clay structure that your soul that occupies that your soul occupies while you're here, right? And so this is how those two kind of mirror each other. And one of the things I think that does go on, and part of this is the medical community, and that is, almost kind of separating. You believe more in medicine than you do in miracles. And that attitude, because if you're just completely dismissive of people's spirituality, of their Christian walk, that person is not going to have as much faith in you. They're not going to believe as much of what you have to say. So from our standpoint, we have to be able to see both, your physical and your spiritual. And yes, maybe my, what I'm trained in is mostly for these medicines, these procedures that kind of get this body together. But also I need to address the spiritual side of you. So like I said, if you come to me and say, hey, I don't want to do this because of X, Y, and Z, I've got to examine and make sure that, okay, do you truly not want this to happen? Do you understand the concepts of what's going on here? And understand, and also explaining that, hey, this is not going to alleviate, it's not going to interfere with your faith. It's not going to interfere with your ability to go to church. It's not going to interfere, like, God's not going to condemn you because you took this medication or because you took this surgery. This is, the same way God, like say you pray and God answers your call. Like say God created physicians, literally, okay, and caused them to study and go through their own, basically go through our own little trials and tribulation. And that information that you're getting is designed to kind of help you live a little bit longer and a little bit better in this physical world that we have. So that's kind of where this whole concept came from, and that is the helping to kind of bridge those two together, understanding that that the stethoscope, the scripture or the spirit are really not separate entities. They really work better together than they do separate. Like I said, times I've had people that, you participate in a prayer or you pray for somebody, whatever, that stuff actually counts as well. So that's kind of where we are. So now next week, and before we go back to that, we're going to say, the other thing that goes on, and this is why faith shows up in health decisions. And that is, even so, as a patient coming in, of course, or you're in the hospital, we got to figure out, you got to understand, what your life is for. That's where the purpose of stuff comes from. And where the purpose comes from, it comes from your religion, right? It also handles how you cope. Like I said, so you get a bad diagnosis, like, you got cancer. Like, how are you going to handle that? the religious part really kind of helps with that piece. Then there's behavior, routines, practice, food practices, whether or not you drink alcohol or not, sexuality norms. I mean, like I say, you're a lot less likely to get a sexually transmitted infection if you're following these Christian beliefs and norms that they establish. Also rest patterns. Remember, as a hypertension guy, one of the things that happens is that people that are stressed, their blood pressure goes up, and sometimes getting people to rest is enough to get that blood pressure down a little bit. Now, you may still need some medication, but it definitely can get it down a little bit. And may be the difference between adding another medication and holding off and watching. I've actually had people in my practice where the blood pressure comes in, it's super high, and I get them to really kind of meditate. You take a couple of deep breaths, you clear your mind, and that blood pressure will come down to the point that I don't have to add another medication, right? And then we have to find out what it is that's driving, driving your blood pressure up. And then also there's community. Like I said, there are literally statistics out there that show that if you have a good community, and remember, Christianity, community is part of what we're supposed to do. We're not called to just kind of be out there by ourselves. We're called to have a community, and all of these things kind of contribute to a healthier you, a healthier body. So this is one of the reasons why, I think that, yes, I think medicine has kind of veered kind of away from faith, Christianity, religions, and stuff of that nature in its effort to become more quote unquote scientific. But at the end of the day, at least from my perspective, I think that if we really kind of look at, first of all, if you look at the data, actually a lot of data kind of supports the use of faith-based programs and religion and maintaining a person's health. But I think that if you get the people with the stethoscope to understand a little bit more, the people with the scriptures, we can show up better for our, for our patients, and get people to, pursue health, wellness in a way that's a lot more holistic. In a way that people can understand, and hopefully in a way that it becomes part of the culture. Because if you start blending this stuff in with, the cultural norms of your religion, then this can show up in a way that, maybe we decrease your obesity. We take the bad food out of what we're eating. We prepare foods at home because, like, hey, that's what we're going to do. We're going to honor the Sabbath. We're going to cook our food the night before, and we're just going to honor the Sabbath by eating together. So we're going to clear out everything out today. We're going to cut the TVs off. We're going to stop the radios. We're going to sit around. We're just going to be a family, right? Because that's one of the things that Christianity promotes. So those sort of things as well. So that's kind of the framework for this. And I know I kind of went off in a number of different directions there. Hopefully that stuff makes a little bit of sense. Next week will be set up hopefully a little bit more structured, right? Hopefully a little bit structured. But like next week, what we're going to do is we're going to try and look at some things like, like fasting, health goals, the role of, like, right now we're in Lent. And so, like I said, how can Lent kind of help you with resetting your health? And so that's going to be the purpose for next week. It's kind of give you a little bit more practical ways to kind of bridge these two together. Today was kind of, more conceptual. At least I hope it's more conceptual. So today was a lot more conceptual. And next week, hopefully we can give you something that's a little more practical. And at some point in time, hopefully within the year, we can find somebody that can probably explain this a lot better than I can, right? So that's going to be it, right? So that's going to be it. So overall, like I said, I just want to let people know that, faith is not anti-medicine, okay? So I want you to just if you walk away with anything, just remember that your faith, your belief in God, your belief in Jesus is not designed to be anti-medicine. Wisdom uses both prayer and proper care. So we want to make sure that that's the message that you walk away with, that's the lesson that you understand. And when if you feel, hey, that, my faith is guiding me or telling me not to, take a medication or not to get a procedure, that hopefully, if there's one thing that we say on this show, and that is go get a second opinion. Okay. So if you get told that you need to take a medication, you get told that you need a procedure, and you feel like, God is telling you not to, or you feel like, your faith is telling you don't have to do this. I always tell people to get that second opinion. A second opinion, not only from, another physician or clinician, but also a second opinion from someone other than yourself. Like I said, maybe you need to go talk to your faith leader, go talk to your pastor, go talk to your priest about whatever this treatment may be. Okay, so that's the setup for the day, and so like hopefully we're getting this set up fairly well for next week. Next week, I'm hoping it's going to be a lot more practical. And thank you for tuning in. Thank you for those listeners that are on WVOE. We greatly appreciate you tuning in. Next week we'll be back on Wednesday, and then thank you for everybody that's watching on Facebook. Thank you for everybody that's watching on YouTube and X. Feel free to leave some comments if you hopefully like the show, or if you got any advice. I greatly appreciate it as well. And outside of that, we will look forward to chatting with you again next week. Have a great weekend.
Thank you, Dr. Brown. Enjoyed you.
All right, sounds good. Hey, take care.